Good morning, all. My name is Isaiah Kettles. I will be presenting the project planning, implementing the clinical practice. The focus of this presentation will be on the project scope, the justifications for the clinical practice, as well as this business side of running the health system, and the stakeholders' engagement and connection. A little information about Bay Bridge. They're a collection of 5 hospitals, 20 physician practices, 5 long-term care facilities, and they have 2 urgent care retails, medical malls, and a health plan that covers 3 million people in the city of San Francisco. One of the initiatives of Bay Bridge is looking to reduce their operation costs by 10%, as well as expanding their market share through virtualization strategies to compete with neighboring competitors such as other urgent care retail centers. In order for healthcare leaders at Bay Bridge to decide on what could be the possible best way to go in implementing different strategies for such strenuous tasks at hand, effective communication is one of the main goals they will have to do in order to reach an agreement to develop which a strategy to figure out which way they need to go and where their focus need to be at. Okay, the roadmap to effective stakeholder communication, for one, is daily communication, communicating with all the stakeholders on a daily basis. A formal policy should be established. Development of competencies in communication, strategy for management of internal and external communication, share data, share timeline, data transparency, and a cultural alignment with a service-based approach, which means value-based care versus volume. So in other ways, the focus needs to be on a patient-centered model. That's one of the main strategies that these stakeholders should be focusing on, making their approach to healthcare more of a patient-centered focus. Now, a little background on the patient portal. The patient portal in my hospital, we use Epic, and through Epic, we have my charts for patients to access in the comfort of their home, on their mobile devices, and other electronic devices. They could access their medical records through my charts. They could view labs, medication, physician diagnoses. In a way, patient portal is a key to continuous care continuum, which a lot of large hospitals around the country are using and ensuring that the consumers or the patients are aware of my charts and using it on a daily basis. The benefits of a patient portal in clinical practice is a tele-fit care plan. It has those components of it. Delivery of safer and higher quality care based on the connection of a doctor's of a patient previous physician and a current physician. Back in the days, physicians used to have to wait weeks at a time before they get a transfer patient record, but due to patient portal, it's just as easy as having it at their fingertips, as everything is electronically submitted. It help physicians just drive in a changing world that we're living in. Is effective in the productivity as well as is good in research development. The clinical justification for implementing a patient portal, it increases efficiency, increases capacity for self-care, it increases coordination of care, effective diagnosis, and reductions of medical errors. Is legible documentation and a streamlined coding and billing, which will be helpful on the business side as well. The business justification for implementing a patient portal. Patients will be able to easily schedule appointments online, increasing the facility and the client revenue. Telehealth is another attribute of implementing a patient portal. Telehealth visits will be offered to patients, will notify their copay before booking and able to make payment online. This will increase the out-of-pocket collections the facility is owed. 29% of the average revenue increase, 98% of average claims that are processed without error. This will help with the proper reimbursement to providers and facilities. Economic challenges and incentives of implementing a patient portal. Cost is one of the most tremendous obstacles in regards to implementation of an EMR. Providers understanding new technology is another obstacle that occurs. That's the one challenge I see as far as implementing this database. An incentive of it, according to the Commonwealth Fund, healthcare providers have received a total of $75 million in Medicare and incentive payments for demonstrating meaningful use of a EHR. So on the other hand of things, as far as public health coverage is you see a lot of healthcare facilities and organizations flourish due to the expansion of Medicaid that was provided through the implementation and the integration of ACA in the last few years. Data benefits as far as the finance piece go, transcription cost reduction, software and maintenance reduction with use of one EMR for all areas of healthcare facilities, storage of paper and records and file reductions occurs due to the portal, patient portal. Yeah, if you have any other questions, please hit me up in the comments. Thank you.